Hi, my name is Dr. Kadir. I am a board certified psychiatrist in California. Today, I would like to talk about a medication for depression and anxiety. It's called Lexapro. Generic name is Escitalopram. I prescribe this medication quite a bit, and I have been asked many times by my patient about what is Lexapro, what are the side effects, how fast it works, do we have to be careful uh, with interaction between different medications. So I would like to talk a little bit about Lexapro. Lexapro, as I already mentioned, it's an antidepressant. It's called selective serotonin reuptake inhibitor, or SSRI. When we are depressed, we have less serotonin in our brain. Serotonin can be increased by many different ways. We can increase it through exercise, through diet, eating more vegetables, meditation, being in a good relationship, being social. So there are a lot of ways to increase serotonin. Sometime when we do that, we don't need to be taking medication, but sometimes our depression is high enough or severe enough, then even trying those things does not help, or we don't have enough energy or motivation to do any of those things. So that's where depression medication works. It does help with our symptoms of depression, like low energy, low motivation. We are feeling sad all the time. Small things bother us too much. Things we used to enjoy in the past, we are not enjoying it as much. Our sleep patterns are not as regulated. Either we are sleeping too much, or we are not sleeping well, or when we are waking up, we are not feeling fresh in the morning. So, and sometimes it becomes so bad that people start having thoughts about dying, or thoughts about hurting themselves, or they start thinking about how they can hurt themselves. So at any point, we start feeling that depression symptoms are there, we should talk to a doctor or therapist about it. So Lexapro is a generic medication. It is being covered by most of the insurances. I also believe that it is being covered by different pharmacy in the dollar for program. I'm not 100% sure about it though, but it is fairly inexpensive. It came, usually people take it starting at a dose of 5 or 10 milligram. I usually recommend starting low dose like 5 milligram, just to make sure you tolerate it well. Most common side effects are like nausea, stomach upset, diarrhea, dizziness sometime, and sometimes even problems with sleep. Usually people take it in the morning, but if you start having sleep problem, then like you are feeling very tired even after being on it for 2 to 3 weeks, then you can take it in the afternoon, evening, or even at night time. You don't have to take it with food, but if you are having nausea, it's better to take it with food. I usually tell my patient to take it in the morning with food. You don't have to have a very full breakfast. Even crackers or toast should be fine. As far as dry mouth, I tell people to drink a lot of water, juice, lemon juice, or sometimes biotin gum, which is available online. Biotin mouthwash, you can get it from different pharmacy stores, so it's over the counter, so that does help also. Sometime antidepressant, not all, but most of them can cause sexual side effect. Usually it goes away, but if it does not goes away, there are few ways to treat it. One is to cut down the dose of the medication. One is to split the dose of the medication, like take half in the morning, half in the afternoon. Or sometimes people skip the dose. I usually tell people not to, but if they have to, they sometimes skip the dose on the day when they think that they will be intimate. So it can help. Sometimes people can add another medication. You can talk to the doctor about it, which medication can help with counteracting the sexual side effect. One of the rare, which I have only seen maybe 1 or 2 times, is serotonin syndrome. It's one of a very rare side effects where you have too much serotonin. because you are taking 2 or 3 different medication that can increase the serotonin in your system, so that can cause side effects like tremors, high fever, and it is it can be an emergency situation. So whenever you feel like that you are having increased tremors, you are getting confused, you are having fever, to talk to your doctor about it. But as I mentioned, I rarely see those side effects. Before you stop any medication, it's better to consult with your doctor. I don't see a whole lot of side effects, withdrawal side effects from Lexapro, but it can happen. Like, especially if you are taking a dose of like high dose for a long period of time, then it's better not to suddenly stop it. Usually, it's better to stop it in few weeks time. Some people are being switched to a different medication, so the doctor will start the other medication to low dose and slowly, gradually decrease the dose of Lexapro and cross titrate those medication. Um, so Lexapro comes in 5 milligram, 10 milligram, and 20 milligram. Excuse me. Usually, it's better to start at 5 milligram and then gradually bump it up. Um, in my experience, between 10 to 20 milligram is a pretty good dose. Some people are up to a dose of 30 milligram. I have some patients who have been up to a dose of 30 milligram, because when they were at a dose of between 10 to 20 milligram, they were feeling they are getting better, but there were still symptoms of depression is still there, so they were not completely recovered. We bumped up the dose of the medication, and they saw pretty good improvement with Lexapro at a dose of 30 milligram. But before you do that, talk to your doctor about it. Um, Usually, it's fairly well tolerated. I don't see a whole lot of side effects from Lexapro. Um, with any antidepressant, it's you have to be careful when you start noticing symptoms of suicidal thoughts, because antidepressant can in some people cause it. So talk to your doctor about it, because they have to figure out if it's the medication or is it the symptoms of depression that are getting worse, and that's why you are feeling depressed, more depressed and suicidal, and maybe the medications are not effective, and maybe they need to try different medication. Another side effects, you have to be careful. A lot of time, people are being diagnosed with depression, but they can have underlying bipolar disorder. So when we try an antidepressant, people start feeling well pretty quickly, but then we notice that they're not sleeping well, they're talking fast, they are having hypomanic manic symptoms, they think they are at the top of the world, they're doing erratic things, they are going on shopping sprees and doing a lot of impulsive things, and not making sense. So the antidepressant can trigger mania, so you have to be careful about it whenever you start noticing any of those symptoms, or if one of your friends or relatives are on medication, just keep an eye on it. Hmm. As far as um, as far as uh, uh, anxiety, I also feel that Lexapro does help with depression, anxiety, even with obsessive compulsive disorder, and in patient with PTSD also. Fairly well tolerated medications. Um, so, if you have any questions about this medication, if I've not covered everything, please let me know. So